While William Pooley has defeated the virus, it is a growing problem in West Africa. It's killed over 1,500 people there already. And now the charity Médecins Sans Frontières has warned that the world is losing the battle against the disease. I've been joined by Vicky Hawkins, Executive Director of MSF UK. Hello to you, Vicky. It is quite remarkable when you see the pictures of William Pooley on the 25th of August, 10 days ago, coming back in that isolation tent by the RAF, and then today sitting there looking a picture of health. But it's a very, very different story in West Africa, isn't it?
Absolutely. The situation in West Africa is absolutely catastrophic, and I'm really not exaggerating when I say that. MSF has been responding to Ebola outbreaks since the 1990s, and this is way beyond anything we've ever seen. We're absolutely in uncharted territory, and we don't know where it's going to go from here. In Liberia, the situation is particularly horrific. Our treatment centres are full to capacity. We have people dying at the gates outside because they can't get in. And these are the biggest treatment centres we've ever run.
And is that because there is a lack of staff there?
Obviously, running an Ebola response is a complicated operation. It requires a huge amount of resources. We have to have 3 staff on standby for every 1 staff that's working in the treatment centre itself.
In case they develop the virus
Because
themselves.
The time that staff are able to spend in the treatment centre is very limited. Obviously,
right.
we set the bar for our safety precautions extremely high to absolutely minimise the risk to staff. So it's a very, very heavy type of operation. At the moment, it's really been in the hands of MSF, the Ministries of Health concerned, and a few other actors. And we need much more capacity, much more resources dedicated to it if we're going to defeat this thing.
It was a month ago that we had the warning from the World Health Organization, wasn't it, that this was a public health emergency of international concern. Yeah. Has the international community stepped up to that warning?
We don't think so, no. Funding has been promised, and funding is indeed being delivered, but it needs more than that. It needs manpower. And what we're really calling for is disaster response teams with medical and logistical capacity to get out there to West Africa. Boots on the ground, basically, to build treatment centres, to provide greater numbers of beds, to assist with the problems of disposing with dead bodies. And really importantly, we need an air bridge, because at the moment air links to West Africa are reduced because the airlines are cutting their services out of fear of the disease, and that obviously impedes our ability to get personnel and supplies to the region.
So should those flight cancellations be reversed then?
We definitely call on air companies and anybody with flight capacity to help with this response.
There is a fear, though, isn't it, that flights, international travel is spreading the virus.
But the only way we're going to defeat this outbreak is to actually treat it at source, at which we need people and supplies to be able to reach West Africa.
We've got some pictures that I think we can show you now that we broadcast yesterday. I believe these are from Monrovia, and an Ebola victim who is walking through the streets, and you can see others running away from him as the medical workers in their full protective gear are trying to catch him. I mean, it just shows the sheer chaos and fear that is out there.
Absolutely. You're absolutely right to talk about that climate of fear. It's the first time that West Africa has experienced Ebola. They haven't seen it before. People are extremely scared. And one of the negative consequences of some of the measures that have been imposed to try and quarantine populations is that it's driven the outbreak underground.
The people are suspicious of medical...
People are suspicious of medical workers, but they're also hiding now. They're trying to flee, and obviously that only exacerbates the situation.
With William Pooley, he was treated with ZMapp. As a drug, we know that it's in short supply. We know that it's untested. Is it the wonder drug that it appears to be when you see Western aid workers and health workers making these miraculous recoveries?
Obviously, there's great promise, but it's going to take a very long time before something like that can be rolled out at the scale that we need in West Africa at the moment. What we need to do first and foremost is concentrate on the tried and tested methods that we have of controlling Ebola, which is basically building up the number of treatment centres, improving the communication with the community so that we can reduce the fear levels, so that people know that they need to bring patients into the treatment centres so that they can be quarantined and they're not infecting other members of the community.